Hi friends! Have you heard the good news that there are curable dementias? Probably not, because it's drowned out by the bad news. Those over 55 have a dementia risk of 42%. Highest risks are women, Black adults, APOE4 carriers, and people over 75. Now, the good news is a big percentage of people probably have preventable and treatable causes. Do you know why? Because common infectious diseases indirectly affect or directly infect the brain to cause memory loss, nerve damage, loss of muscle, and personality changes. And you'll also be surprised to learn that your brain has a microbiome too. The wrong microbiome causes dementia. So it's really important to know what kind of microbiome you have so that you can potentially help your brain out. Now, we're going to talk about some important solutions that most people overlook when it comes to their brain health. We'll also talk about the most common infectious diseases that either directly or indirectly affect your brain and ways in which you can reduce your risk of dementia, especially how you can find out if you have a treatable cause. Now, remember, I'm not your doctor, so if you're concerned, talk with your own medical doctor. Now, the brain is one of the most delicate and vital organs in our body, and that's why changes in your health or in your body often changes your brain. You immediately feel it. Tiredness, lack of motivation, sadness, agitation, etc. Infections anywhere in the body can lead to confusion, memory loss, and even long-term cognitive decline. Dehydration, inflammation, immune response, lack of blood flow, lack of oxygen, or direct damage to brain tissue all play a vital role in the health of your brain. Now, the most common infection that is guaranteed to spread every year is the flu. And this year, they've been watching the avian flu that could potentially rapidly spread. And did you know that every time you get a cold or flu, you increase your risk of dementia? So let's hope that avian strain doesn't spread. Wear an N95 if you are concerned about getting it. Have you ever had the flu? I had it during medical school. I remember I couldn't stand up straight. I had a terrible headache. I was terribly dizzy, super tired, and I couldn't stop coughing. It took me 3 months to get over that because my immune system was shot since I had a single-digit vitamin D level. That's really, really bad. At the time, I didn't realize people with very low vitamin D levels are at high risk of getting respiratory infections. So that is something you can go see your doctor to get checked. I also didn't realize that taking N-acetylcysteine has been shown to reduce symptoms. That was my first year in medical school. I didn't know there was medication to treat the flu, probably because it's reserved for those who have severe symptoms or at high risk of having severe symptoms. It's called Oseltamivir. So if you suspect you have the flu, then don't wait because it's most effective when given within 48 hours of onset of symptoms. Now, you have to see your own medical doctor to get a prescription. Now, I do agree that there are natural things that people can do to help minimize symptoms and maximize one's immunity, but sometimes people's immune systems need professional help. And by the way, an antiviral is not the same as an antibiotic. Antibiotics do not treat viral infections. Now, some of you probably don't think it's a big deal since you know plenty of survivors. You may have survived yourself. Unfortunately, many are not so lucky, and even more have their quality of life changed even if they do survive. So why do people get super sick and others have really no symptoms? The answer is inflammation. A person's inflammation is a major factor in disease severity. But when you have inflammation in your brain, you increase your risk of acute and long-term memory problems. When your immune system is stimulated by an infectious agent, pro-inflammatory cytokines such as interleukin-1, interleukin-6, and tumor necrosis factor are produced and activated by immune cells such as macrophages, monocytes, endothelial cells, fibroblasts, stromal cells, hepatocytes, B cells, and T cells. And many of these cells exist all over your body. And luckily, your body also has ways to control inflammation with anti-inflammatory cytokines such as interleukin-4, interleukin-10, interleukin-11, and interleukin-13. And to further complicate immunity, many of these cytokines play multiple opposite roles. For example, interleukin-6 can be both pro-inflammatory and anti-inflammatory. Hence, over-suppressing inflammation can suppress recovery. In addition, other inflammatory proteins, such as Janus family kinases, are key to the formation of cytokines, but they also are involved in cell growth, survival, differentiation, and development. Now, we have medicines to modulate these cytokines, but because they have dual roles, they potentially come with severe side effects. Complex, isn't it? However, the basics of influenza treatment options for most providers are really not complex. When you see your medical doctor, they really have less than a handful of drugs to use to treat the flu because we lost some drugs due to development of drug resistance. Hence, we don't want to give it out unless we think you really, truly will benefit. The main class of drugs are Neuraminidase Inhibitors, which work by preventing the spread of flu babies from your own cells. You see, viruses, they don't have equipment to multiply. They will hijack your cells and your cellular equipment to make their babies. Now, if you can prevent the babies from hatching or being released, then you are successful at limiting the spread of infection. So this works for both influenza A and influenza B strains. And basically, the flu babies, they get trapped in the infected cells. Unfortunately, this isn't a perfect world, so resistance to really all our anti-infectives can happen. And hence, we don't give treatment to everybody. And in general, if you're young and healthy, if you just have mild symptoms, your physician may not think you need it and just give you treatment for your symptoms. And as a society, we all need to be responsible and careful about using anti-infectives to prevent them from being ineffective. Now, there are several members in this family. Oseltamivir, which is a drug of choice, and we basically will dose that based on a person's weight if they are at least 2 weeks or older. And this we can give as prophylaxis, but if you're symptomatic, the greatest efficacy is to initiate it within 48 hours of your symptoms. We do use this intravenously for very severe infections in the hospital, and we can also use it for post-exposure for community outbreaks. And in certain people, we may even give them pre-exposure prophylaxis if we think that they are immunocompromised. Now, if your kidneys don't work well, then the dose needs to be adjusted. And of course, everything comes with side effects. And unfortunately, it also comes with brain side effects. It can cause headaches and delirium. Hence, oseltamivir, like most drugs, need to be prescribed and monitored. Zanamivir is a second drug. It is an inhalation-only medication. It's to be given twice a day for roughly a week. It's used for mild cases for basically outpatient treatment for people who are 5 years and older. So this is for really mild illness. And again, the greatest efficacy is to give this drug within 48 hours of symptom onset. Now, unfortunately, it's not well tolerated and inconvenient to give. And one of the side effects is ironically more breathing problems. And in addition, it can cause GI distress, maybe because people are swallowing the medicated air. Now, peramivir is the only single-dose FDA flu drug. It's still given best within 48 hours of symptom onset. It is convenient, but not recommended for prophylaxis and not recommended for severe cases. Your doctor will also have to adjust this for your kidney function. It also has a lot of metabolic side effects. And if you think you have the flu, you should see a medical provider because those drugs are prescription only. And it's not uncommon to get a secondary bacterial infection when you get a flu or cold. And together, if you get both, that can lead to a severe pneumonia, which means that the respiratory infection is causing inflammation in your lung tissue. And these infections often can cause an increased mucus production, constriction of airways, or exacerbation of asthma, which all result in less oxygen. And people who get pneumonias are at higher risk of developing dementia. And people who have dementia are at higher risk of getting pneumonia. And unfortunately, many people don't survive pneumonia. The good news is there are several ways to prevent pneumonia. Now, if all of these infections lead to dementia, then it's important to prevent the infections. And that's what the Japanese, they try to do. The Japanese tackled the problem in a nursing home by encouraging their elderly to gargle with green tea. And guess what? They got less colds. Now, green tea has several anti-infective properties that can help you reduce pathogenic organisms in your mouth. Green tea actually has a compound called epigalactocatechin gallate, or EGCG, that has been shown to untangle fibers called tau that leads to cell death in Alzheimer's. Now, many people don't realize aspiration is a root cause of many community-acquired pneumonias. How many of you have ever choked on water? I've done that when I don't pay attention to swallowing. But aspirating a bit of clean water is not the same as aspirating water full of germs, which is your saliva. Inhaling your saliva, which we all do to a certain extent, especially when we're sleeping, can be a problem if your immune system is weak and if you have difficulty controlling your swallowing muscles. Hence, I make sure I rinse my mouth out after I eat. And I make sure to brush my teeth, floss, and rinse my mouth again before I go to asleep. And this is why it's a good idea to gargle after you eat. Have you noticed how much food gets trapped in your gums and in between your teeth? Popcorn is the worst. I was so tired the other day coming home and I was hungry, so I ate a bunch of popcorn. And then I was super sleepy, so I wanted to take a nap. But I could feel the particles in my mouth. So I got my butt up, rinsed my mouth before I laid back down to take my power nap. It's super important never to eat laying down, no matter where you're at. Whether it's breakfast in bed, at your home, or in the hospital. And remember how your mom always told you to sit up straight? That's actually protective. Sitting up straight, leaning forward, as if you're sitting on a dining table, allows gravity to pull your food away from your windpipe. This position also forces you to use your own swallowing muscles. Likewise, don't cock your head back when you're trying to drink water or eat anything. This motion opens up your windpipe. But when you lean forward, put your neck down a bit to eat, you actually make your windpipe smaller to reduce the risk of aspiration. When you aspirate food, it can be trapped in your lungs, cause inflammation, and feed the germs in your saliva. Another pet peeve of mine are straws. This is why boba drinks are so dangerous for kids. And if you don't want to aspirate, avoid straws. And this is especially important for those who are recovering. And I know people hate it, but using a consistent size serving spoon to scoop water or food is always best. I mean, that is how we feed babies. Thank goodness babies take a while to learn how to use a straw. Now, oftentimes people don't cough immediately when they're aspirating. The ones that don't cough at all have the worst cases of pneumonia because your coughing reflex is protective. And some people may not cough for about 20 or 30 minutes after they finish eating or drinking. So if you suspect that you're having swallowing difficulties, it's important to get a swallow study ordered by your physician to minimize the risk of choking. Now, a third treatable and preventable infectious disease that increases the risk of dementia are urinary tract infections. And if you already have dementia, it can definitely worsen it. Now, most of the time, women are getting them due to their anatomy and lifestyle habits, such as wearing tight clothes, soaking in the bathtub, or ferociously cleaning, douching, or wiping, especially in the wrong direction. Now, let's face it, there is just no ways to sterilize private tissue down there. There is a private microbiome that's actually protective. And when you're douching or rubbing soap or chemical wipes, you're actually destroying your own microbiome. And in general, the best thing to do is to flush it with some water, pat dry with a tissue, and drop it. Rubbing back and forth does not help anything. And when you're rubbing, you're actually damaging your friable tissue, removing the healthy microbiome, irritating yourself, and then possibly even shoving the germ in your urethra. And after menopause, this problem gets worse and worse because the tissue gets thinner and thinner. For people with recurrent urinary tract infections, sometimes using topical estrogen can be beneficial if there's not an inherent anatomy problem. But I think the biggest lifestyle habit that many people ignore is water. You gotta drink enough water because if you have a problem with your urinary tract, you have to flush it. It takes very little effort to get dehydrated, but a ton of effort to get well hydrated. Dehydration increases your risk of colds, pneumonias, urinary tract infections, and so many other problems. Remember, you have to have blood flow for your immune system to help. And monitoring how much you drink with a timer and a measuring cup is really helpful. Setting alarms to go to the bathroom regularly is also a must for everyone. And when you're there, take a look at your urine. If it's not the right color, then you may be dehydrated.
Hi friends, I am so thrilled that you want to take charge of your health and take charge of your food. Now, I know nutrition can be complex, but it doesn't have to be. And I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in my show notes and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video now.
And another one of my pet peeves is that people automatically take antibiotics without a urine culture. Unfortunately, there is so much drug resistant now that many antibiotics, they don't work. And you can't pivot unless you know what you're treating. Every time you take an antibiotic for any reason, you will have friendly fire and destroy your own microbiome in your gut, in your urinary tract as well as in your private parts. This all breeds drug resistance. And that's why it's super important to do it right and to minimize your exposure to antibiotics. And believe it or not, some people may think they have a urinary tract infection because they have all the right symptoms, but they may not have one unless they have a positive urine culture. And in case you didn't know, pneumonias and urinary tract infections and the flu, they're all gateway to sepsis, which can really accelerate dementia. Sepsis is an inflammatory reaction in your entire body. This is a life and death situation, which I treat frequently. And people who have sepsis will feel tired, confused, lightheaded, and sometimes even pass out. And that's why it's really important for everybody to avoid and catch infections early. Septic patients have a high mortality rate. The good news is most people recover from the flu, pneumonias, and sepsis if we can intervene early and use the right anti-infective therapies. However, many struggle to fully recover and have a new baseline in their memory and quality of life. That was my mom. She basically got a urinary tract infection. Since it hurt to pee, she decided to stop drinking. It makes sense, right? Yeah, a logical logic. Luckily, I visited her that day and I knew there was something off about her. Her heart was racing, she looked pale, and she was having a fever. So I took her to the emergency room where they started fluids and got cultures and gave her empiric antibiotics. She spent nearly a week in the hospital and had to learn how to walk again. Now, even though her physical body made a full recovery from her urinary tract infection, her memory and personality was never the same again. That is how severe sepsis can be. Remember how I said your brain has a microbiome too? Whenever you are exposed to germs, some of those germs may sneak in and live in your body and brain like syphilis. Syphilis is an STD caused by the bacterium Treponema pallidum that can live dormant in people for decades. The disease progresses through several stages if untreated: primary, secondary, latent, and tertiary syphilis, which is a stage that can infect your brain. Now, I have seen all these stages. Each stage has distinct symptoms. The good news is the infection is easily screened for with a blood test. However, if a brain infection is suspected, then spinal fluid and neural imaging is helpful. The infection can be cured with appropriate treatment and symptoms can improve. I've literally seen people recover their walking abilities as well as their talking abilities after treatment. Syphilis spreads primarily through direct contact, so touch, from syphilitic sores called chancres. They are also painless sores in private parts. An infected mother can also spread it to her child during pregnancy, which can cause congenital syphilis, which is very severe for the child. Primary syphilis has sores that may go unnoticed and can last for a couple of months. Secondary syphilis often occurs after sores disappear, and that presents as a generalized rash on the body, hands, and feet. Now, both primary and secondary syphilis, they are highly contagious. Hence, I don't shake anybody's hands if they have a rash on their palms. Believe it or not, those symptoms can come and go for an entire year. Now, latent syphilis begins after the ulcers and rashes disappear. And usually, people have no symptoms. They're also not infectious, except for vertical transmission. They can still give it to the fetus. Now, many people with latent syphilis, they don't even know they have it. So they remain undiagnosed because they don't seek help. The problem is the infection is still in the body and can lead to severe complications, such as blindness, heart failure, deafness, seizures, and dementia. Syphilis has actually made people go insane. Now, this is tertiary syphilis. You're not infectious, but you get severe organ damage. Syphilis is an ancient disease proven by radiocarbon dating of bone fragments found in America. And after Christopher Columbus's voyage, Europe exploded with syphilis cases. Believe it or not, if you lived in the 16th century, they would have tried mercury ointments on you to treat syphilis, despite the fact that they knew it was toxic. And in the early 20th century, they were using arsenic-based drugs, which also had severe side effects. Luckily for us, since the 1940s, penicillin was discovered and revolutionized the treatment of syphilis. And this is still the gold standard of treatment today. If you're diagnosed with syphilis, then benzathine penicillin G is the first line of treatment. And if you have allergies to penicillins, if you have a severe enough infection, your doctor may want to desensitize you. Or if they think you qualify, then they may prescribe alternative regimens such as doxycycline. And after treatment, it's important to still follow your titers. For most people who have a good, strong immune system, penicillin treatment is very effective and is curable, especially when given early. Now, syphilis is a bacteria, but there are viruses that can infect the brain. Have you ever had cold sores? A common cause of cold sores is HSV or herpes. There are two types of herpes, HSV1 and HSV2. HSV1 generally causes cold sores in the mouth. Sores in the private parts are usually caused by HSV2. Now, both HSVs, they live in your neurons, and your biggest collection of neurons is in your brain. So some people, their first symptom may be a sudden bout of confusion, they may have personality changes, they may have fever or lethargy. And if your doctor wants to figure out why you have those symptoms, then it's very reasonable for them to want to do a spinal tap. They'll take that spinal fluid and send a PCR test for different strains of herpes. And in the meantime, while they're waiting for the results, they'll probably empirically give you intravenous acyclovir. Acyclovir tries to trick herpes. It mimics the building blocks of HSV DNA. Specifically, it is a nucleoside analog that resembles deoxyguanosine. After entering your cell, acyclovir is converted into acyclovir monophosphate by the herpes enzyme thymidine kinase. This ensures activation primarily in HSV-infected cells only. Therefore, it minimizes the toxicity to healthy cells. Then your own cellular kinases, they take over and convert acyclovir monophosphate into acyclovir triphosphate. Acyclovir triphosphate competes with deoxyguanosine triphosphate for incorporation into HSV DNA. And once it's incorporated, it acts as a chain terminator to stop the replication of HSV DNA. Now, you may have used valacyclovir, which is a prodrug of acyclovir. This means it needs to be converted into acyclovir in the body, and then it goes through the same steps to be active. So valacyclovir itself is inactive unless your liver can convert it into acyclovir. Now, people who have used acyclovir know that they have to take it multiple times a day because it's poorly absorbed in your system and only lasts a few hours. Sometimes you have to take it 5 times a day. However, valacyclovir is much better absorbed, and therefore we can give it less often. Now, common side effects to both include nausea, vomiting, diarrhea, headache. You can also get nephrotoxic. That means that it can harm your kidneys. This is because acyclovir can crystallize in the kidneys, especially in the renal tubules, when people are dehydrated. That's why you have to stay well hydrated. And this occurs more common when we give acyclovir intravenously. Unfortunately, it can also be neurotoxic and cause encephalopathy, tremors, confusions, or hallucinations, particularly in patients who have kidney problems. And locally, if you're getting an infusion, it can cause an infusion site reaction, and rarely it can mess with your bone marrow and cause thrombocytopenia or anemia. Now, valacyclovir can cause hemolytic uremic syndrome, which sounds pretty bad because it is. Now, the problem with all anti-infectives is drug resistance, and treatment for HSV is no different. These germs, they're really smart, and they mutate very quickly. So they can mutate their viral thymidine kinase, which is needed to convert acyclovir into an active drug. Now, just by removing the phosphorylation, now the drug is inactive. This is the most common way HSV develops resistance to acyclovir and valacyclovir. Now, the second way is through a mutation of the viral DNA polymerase. Now, this results in a reduced binding ability of acyclovir triphosphate, which means they won't incorporate that fake nucleotide. And like other anti-infectives, you'll have cross-resistance with other similar molecules. Now, if the virus is resistant to acyclovir, it will be resistant to valacyclovir, famciclovir, and penciclovir. This is because they're all structurally very similar. Now, remember, if you have any questions about anything that we've discussed, then you need to go see your own personal physician. Now, I'm not telling you this to scare you. I'm telling you this because knowledge is power. Now, the good news is most of us have a competent immune system, but it takes work on a daily basis to keep it strong. So if you want to know more about which foods can keep your immune system strong, check out the next video.